Now let's cover basic life support for the adult in team approach. Team approach has been best known when we're talking about advanced cardiac life support with team leaders and running the mega code. In this case, we're going to apply some of those same principles, but at a basic life support level. It works extremely well. This is a situation where you're probably more in a clinical setting or with multiply trained rescuers. So what's neat about this is that you have the ability to kind of step back as a team leader and usually take a role of rescue breathing while you direct the other team members to do specific jobs. It's efficient, it's effective, and it's a great way to provide this type of basic life support when you have extra help. So we're going to walk through these steps. The same thing's going to apply. Scene is safe, gloves are on, CPR shields available. Ideally, you would bring in an AED, bag valve mask, crash cart immediately with you if you knew this was happening. But let's just, for this scenario's sake, say that someone made you aware or a couple people were in the hallway that someone's not responsive. The first rescuer comes in, is going to actually do the same thing. Tap and shout, are you all right, are you okay? Look to see if the patient is breathing normally or not breathing or in agonal respirations, which qualify as not breathing. If that's the case, they're going to call a code or activate the emergency medical response team. And then they're going to check for a pulse. No pulse is found, patient non-responsive, no breathing, no moving. They're going to go right into two-person CPR if there's two rescuers. If there's only one rescuer, they're going to call for help. Hallway's going to hear them. They're going to come in, and now they're going to have at least a couple rescuers. Now keep in mind, the emergency medical response team has been activated, so more help should be on the way, and ideally they're going to be coming back with gear. AED, crash cart, bag valve mask. When we go through the practice session, we're going to show what that looks like and how it works in a choreographed manner. While the person is doing CPR, if a person walks in with a bag valve mask, they can then come over and take team leadership and start the ventilations with the bag valve mask. Benefits of that is that with room air, you're giving the patient oxygen, but no carbon dioxide. So now we're not adding more carbon dioxide to the person's bloodstream, causing that acidic problem that we were talking about before. This person can now be supportive role and exchange places with the initial compressor, which allows them to take a break and for us to consistently continue those deep 2-inch plus compressions at least 100 times a minute in order to keep that circulation level up. Ideally, the AED is soon going to arrive if it's not already on scene. They're going to go ahead and prepare the patient's chest. Remember what we talked about with wiping off excess sweat, making sure the scene is safe to be able to use the AED, meaning there's no combustibles, no liquids, no flammables. Then they're going to go ahead and apply the AED. Compressions will stop, respirations will stop, AED's in place, we let it do its thing. Ideally then, if the crash cart's not already there, we have an additional runner who begins to come in. They'll probably ask, is there anything I can do to help? This could even be an administrative role. At this point we say, yes, Janet, could you please go and grab the advanced life support crash cart and return quickly. They go ahead and do that, which is going to get us the medications, the intubation equipment, the suction equipment, everything else we need to be able to turn this into a high-speed, life-rescuing event, and it's going to work really well if you practice this from a team approach.
Scene is safe, gloves, mask. Are you all right? Are you okay? Rex, go activate the emergency response team and come right back. I'm going to take over breaths now. Can you do compressions?
Yes, I'm all ready.
Hey guys, what's going on?
Got a guy down.
Okay, no pulse?
No pulse.
Okay, I'm going to go ahead and take over rescue breathing. Jody's just got here with the AED.
Okay. Hey, is there anything I can do to help?
Yeah,
This
Janet,
is
could
a
you
training
go ahead and go
device only.
get the
No
advanced
shock
life
will
support
be
crash
delivered.
cart and come back as quickly as possible,
Yep, I'm
please?
on it.
Thanks.
Remove clothing from person's chest.
Looks like the scene is safe to use the AED, no combustibles, no standing liquids.
Attach pads firmly to person's chest as shown.
Does anybody know how long this person was down?
Just walked up to it.
Okay, was
Yeah.
unresponsive when you got here?
Unresponsive, yeah.
Got it, okay.
Plug in connector.
They have a no-code status or anything
Analyzing
like that?
rhythm.
Could you, in fact, could you
Everyone stand
tell
clear.
Janet to also bring
Clear.
in the no-code status
Okay.
and paperwork, please?
Shock advised. Charging.
Everybody clear?
Everyone stand clear.
Clear?
Everyone stand clear. Push the shock button.
Clear?
Clear.
Shock delivered. Begin 5 cycles of CPR.
3, 5, 6, 7, 8, 9.
Okay, at this point, we're going to continue 30 compressions to 2 rescue breaths using the bag valve mask if available. We're going to continue this until the AED interrupts or until the full advanced life support crash cart gets here and we bring it to the next level.